All right, guys, this video is for anybody that may have missed class. This is GV Black classification of caries. It's been around for about 100 years, not exaggerating. This is very common in dentistry, just like the tooth numbers, just like the tooth surfaces. The classifications are important and used on a daily basis. Okay, so class 1 is caries affecting pits and fissures. Let me remind you again, what is caries? It's plural for cavities. It's the professional word for cavities. So pits and fissures on anterior and posterior teeth. So on a posterior tooth, it is going to be right in the pits and fissures on the occlusal of a molar or premolar. Right here, this little arch, I'll just remind you, is called the cingulum. This is going to be on the lingual of an anterior tooth, so a central or a lateral. And this cingulum area can be more prominent on from patient to patient. So, and it usually has like a little pit in it, and little pits are prone to getting cavities. So that would be a class 1 if they get a cavity in those areas. Class 2 is caries affecting proximal surfaces on posterior teeth only. So that's going to be your mesials and distals interproximally. What does interproximal mean? In between the teeth. Okay. Class 3, it's the same as class 2, but we're talking about anterior teeth now. Okay, so proximal surfaces, mesials and distals in between the teeth, but anterior. Okay. Class 4, it's just like class 3, but it involves the incisal corner as well. Okay, so caries affecting proximal areas, including incisal corner. So I drew a 4. This is how I always remember it. If you draw a 4 like this and then put a little right angle right there at the corner, that's just what I visualize in my head. It helps me remember, oh yeah, class 4 is the one that involves that incisal corner. Class 5, very popular. I would say out of all the classifications, class 1 and class 5 are the most common areas to get cavities. So class 5 is caries affecting the cervical third, anterior and posterior. It's right at the gum line. So I'm gonna go down a rabbit hole here and just ask you, like, why? Why is class 5 so common? Why do people get decay at the class 5 area? Well, I can tell you, it's they don't brush the gum line good. They either haven't been educated, or my opinion is that a lot of them have gingivitis from not brushing the gum line, and so when they brush their gums bleed and they hurt, so they try to stay away from them. But then at the same time, they're making their situation worse by not brushing their gums. So it's just this revolving cycle of harm. So we need to educate our patients that you've got to brush the gum line good. All right, class 6. Now this is the most uncommon of all the classes, and it's caries affecting cusp tips on molars and incisal edges. So for an anterior tooth, I had to draw it because they didn't have it on here, but this is my central that I've drawn, and I colored the incisal edge red. And so this is going to happen on patients that are severe grinders. They have ground through the enamel and they've ground down to the dentin. Dentin is soft. Dentin is very easy to get a cavity. So that would be a class 6. Class 6 on a posterior tooth would be right on the cusp tip, and it really, in real life, it looks like a volcano. You know how volcanoes at the very top, they're going to have that little circle where the lava comes out? Well, that's what it kind of looks like in real life. Okay, so those are your GV Black classifications of caries. They are used every day in the dentist office for filing insurance and for documenting what the patient is having done. So if you have any questions, just ask me, okay?